June is Alzheimer's and Brain Awareness Month, and the Alzheimer's Association wants you to know that right now is the time to take charge of your brain health. According to the organization, more than 55 million people worldwide are living with Alzheimer's or a different type of dementia. Dr. Nidhi Kumar is on call to talk more about the disease and the steps you can take if you or someone you love has memory concerns. Good morning, Dr. Kumar.
Good morning.
Now, we've all heard about Alzheimer's, but what is it specifically and how prevalent is it in the U.S.?
Well, Alzheimer's is the most common type of dementia, and it leads to problems with memory, learning, cognition, even behavior. And it's caused by an accumulation of clumps of protein in the brain, and we call these plaques. We call these amyloid plaques, and they interfere with the normal function of brain cells or neurons. Now, it is incredibly prevalent. 1 in 5 women in the United States will develop Alzheimer's. 1 in 10 men. Black and Hispanic patients are disproportionately affected with this disease.
Wow. Those numbers just blew me away with what you said. Now, you said Black and Hispanics. Is there any other populations that are most affected?
I mean, really, it is these populations that are affected almost twice as much as white patients, and it's thought to be related to issues with access and healthcare and lifestyle choices and prevalence of certain other medical conditions in these communities, such as high blood pressure and diabetes.
What are the risk factors for Alzheimer's, and is it preventable?
Well, the most common risk factor is age, and really we can't do anything to stop the clock. However, there are controllables that we can control in terms of lifestyle. Having a lifestyle where you are exercising, eating an anti-inflammatory diet, which is low in ultra-processed foods, not smoking, and making sure your blood pressure is under control. Because the more inflammation in the body, the more inflammation in the brain. And I want to make the very important point that Alzheimer's disease, the changes that occur in the brain start 20 years before you see anything clinically. So that means it's really important in your 40s and 50s that you are living your healthiest life possible.
What are some of the early signs of Alzheimer's?
Early signs: forgetting new information, so inability to retain new ideas and new concepts, asking the same question over and over again, difficulty with finding words, and then we see some behavioral changes, irritability, changes in mood, social withdrawal. Noticing that your older family member maybe doesn't want to attend the family gathering or the birthday party. These are small changes to clue you in that something bigger may be happening.
Now, we hear there are new treatments and clinical trials for the disease. Can you tell us about those?
Well, so historically, a lot of the treatments have, really centered on working on boosting chemicals in the brain to get those brain cells communicating better, but they're not really dealing with the upstream issue of Alzheimer's. Just in 2023, a new medication was approved by the FDA called Leqembi. And what that is a monoclonal antibody. So you're actually using a patient's own immune system to help clear and prevent these plaques that develop in the brain. Has been approved for patients with mild Alzheimer's disease, and that is why it is so important to recognize these symptoms. Also in the pipeline, clinical trials looking at repurposing anti-cancer drugs, looking at drugs to reduce inflammation in the brain. And I want to say we cannot have a conversation about Alzheimer's disease in women without talking about hormone replacement therapy. Now, it's a mixed bag in terms of the research, but there are some proponents of hormone replacement therapy, some experts in brain health, that feel that this can really lower risk in at-risk patients. So important for women to talk to their doctors, and again, 40 and 50-year-old women who are just perimenopausal or entering menopause, to talk to their healthcare providers about this.
Wow, Dr. Nidhi Kumar, thanks so much for joining us. So much important information. Thank you.
Thank you.
And remember, you can see Dr. Kumar's reports every Monday at 7:15 a.m. right here on CBS News New York.